vasculitis. Actually, it's one of the drugs well known to be associated with it. There's some others as well. Many antibiotics, as Phil said. Many forms of drug-induced vasculitis are short-term. You stop the drug, it goes away, but not all. And actually, some forms of ANCA-positive vasculitis can be caused by drugs and others. Most of the time, though, it's self-limited, we hope. So it's important to try to figure out. And so we often have patients, we go back 6 months or more, ask, what have you taken, et cetera. And it might not be prescription drugs. It can be drugs, recreational drugs of abuse. It can be alternative medicines, et cetera. Other questions? I'll stay in the middle and then move over. So if I can restate the question a little bit, if you have one form of autoimmune disease, can that lead to another form or lead to vasculitis? Connie, when I answer, take a stab at that difficult question.
So I think the concept was introduced that we distinguish between the so-called primary vascular disease and the secondary vascular disease. In the primary vascular disease, we do not believe that there is another disease that underlies it. Whereas in the secondary vascular disease, indeed, these patients do have another diagnosis. For example, lupus, and in the setting of their lupus, they develop vasculitis. However, when you go to the broad range of so-called immune-mediated diseases, essentially, we wouldn't be here if we wouldn't have an immune system. We share this planet with other inhabitants that have been here long before us. And we defend ourselves against being invaded by these pathogens, and if they want to live where we want to live. So immunity is something that defines us in a very fundamental way. We have immunity occurring every single day of our life, otherwise we couldn't persist. Immunity plays a role in many different disease forms. I think the most interesting, actually, for all of you is the fact that we now believe that diseases like heart attacks are pretty much immune-mediated diseases, that they are inflammatory diseases that are caused by the inflammatory system. And in that sense, they fall into that broad category. We do have a narrower category of diseases we call autoimmune diseases. And as Phil explained, we make a distinction between things that live naturally in us and we tolerate them, or things that we fight against and that we try to get rid of. And in the autoimmune diseases, we at least do not know what that thing is, what the immune system finds. But overall, coming back to your question, physicians should be able to make a distinction between a vasculitis that occurs as a primary vasculitis or a vasculitis that occurs in the setting of another immune disease.
Question?
Under the understanding that the disease itself is basically like your immune system is kind of running around the line. Is that not an accurate description? I mean, it sounded to me like when you were describing what was happening with the cells, it's like your immune system is still recognizing the foreign body, but in a bad place for it to go and attack it and destroy the surrounding tissue, stuff like that. So is the immune system still working as far as attacking the bad cells, or is it,
So the question is, when you develop vasculitis, is that the immune system going completely crazy, or if there's still a little bit of structure to it? And I think the answer is the latter. And if you think about it, most people who have vasculitis, most of their body still works. You might lose a kidney, you might lose your lungs, but you typically have parts of your body that are working fine. Or you're sitting in a chair, you're upright, you're chatting with me, some people are laughing, a lot of parts of your body work. So the majority of your system actually is pretty much intact. It's just a significant portion that you really need that's going on.
All right. Right behind you, we're going to try for some short questions and some relatively brief answers as well, so keep going.
You talked about inducing remission also, what are the complications of having more than one form of vasculitis, like Weyland or
So a couple of questions there. I'll repeat the first and I may pass the second, but the question was, what if remission doesn't come if you have continued disease? So one of the things you should pay attention to during this meeting is you'll hear us talk a lot about active disease and inactive disease. We'll talk about active disease and damage. And one of the things that's very hard for patients and for physicians is to separate, figure out what's actually due to active inflammation and what's due to damage from inflammation or from drug before. And I think we all see, in the area of overtreatment, we often see people who are treated for a long time for things that aren't active. They're damaged. They're never going to get better. And so that's bad, but you don't want to treat that. So people may have they may have lost 50% of their kidney function. And at certain points, you realize it's not going to come back. You can live perfectly for a long, long time, forever, with 50% of your kidney function. But if you keep treating it because there's some blood or protein in urine, you're actually maybe over-treating. And so you have to separate out what's active and inactive. But there are, and so that's one issue. But there are people who just continually have active disease, and that's what we'd like to eliminate. And the consequences of that down the line may be not good for those organ systems that have been involved. And there's some thought that lots of inflammation can lead to heart disease and other things and other diseases. For most patients with vasculitis, it's not continual. But not. You had a second question about what if you have more than one form of vasculitis, but you actually asked particularly about Wegener's and goodpasture. So maybe Felipe can sort of explain that.
Well, this is important as to make a distinction. Goodpasture syndrome is one thing, where you get what I mentioned, renal pulmonary manifestations. And a syndrome is a constellation of signs and symptoms that can be present or explained by different diseases. Although there are some patients who have what actually is called goodpasture disease. And this is caused by another kind of antibodies. And sometimes they really can be present together. But in a general way, the therapy might be the same with one distinction. And that is that in goodpasture disease, which is caused exactly by these antibodies to the membrane that holds the cells of the kidney and the lungs, you get the antibodies removed by plasma exchange. And sometimes this overlaps with what happens with vaginus, where when you have a very severe form of renal involvement, you also get this therapy. So at the same time, you're treating the same manifestations in both diseases with one approach. And then the main difference would be that if you also have vaginus, and this is quite rare, I mean to have two forms of vasculitis is simply very rare, but it can happen. You continue with the remission induction phase, and then after with the maintenance phase of the disease. So sometimes both approaches to both diseases combine, and you can get better by this way of treating the disease. But this is actually quite strange to have both. By itself, each of the diseases are very rare. To have them both is really bad luck. But anyway, when you have it, there are ways now to remove those antibodies in one disease, and we know now that in some of the vaginous patients, this ANCAT, also to have them removed can be also very favorable. And you need to hold the therapy maybe for a longer time for vaginous than for goodpasture disease.
So over here, we'll go to this side.
Sure, I just had a question. What's your experience in terms of treatment for people who are experiencing severe reduction in hearing?
In hearing? So this is so the question is, what is your treatment for reduction in hearing? I'll take this. I have a particular interest in the hearing loss we see in vasculitis. We've done some research on this. I think that hearing loss, which is seen in Wegener's and microscopic polyangiitis, and occasionally in Church-Strauss, and more occasionally giant cell or other forms, but it's really quite unusual, can be a devastating problem. I think hearing loss is underappreciated as a problem in vasculitis by physicians, by patients, And it really is a problem. And I think that you need to be keeping track of your hearing, and if it's changing, you need to get it checked out. And I don't mean, we all get hearing loss as we get older, but actually studies have shown, including our group, that the hearing loss, even as people get, of older patients with vasculitis, is more common than it should be, even for getting older. So there's really other things going on. It's often the vasculitis. Two forms of hearing loss: the blockage, what we call conductive hearing loss, gunk in the hearing canal, usually inside the head, and sensory neural hearing loss, which is nerve damage. The latter part, the nerve damage, is particularly bad because it doesn't really recover too well. The conductive part can actually get better quite quickly. And so the answer is you got to treat the underlying cause, you got to treat the underlying disease. If at a certain time, true for all of the organ system problems, you may just end up with some residual hearing loss that isn't going to get better, and then amplification may be useful, hearing aids or other problems. But be very sensitive to your hearing. There's one exception, which is when you can't hear your husband or your wife. That's sort of selective. That's selective spousal hearing loss. That may actually be good from an evolutionary standpoint, but in general, if you're having trouble hearing on the phone or turning up the television, then you really need to get checked out. A hearing test is cheap and easy, and it's a great way to follow things. So we follow your kidney, we follow your lungs, we should follow the hearing. In the back.
I hear everyone, when you talk about vasculitis, other types of autoimmune diseases, talk about the inability to turn the immune system on. Yet, and there are 5 people with autoimmune diseases in my family. My daughter has Behçet's.